It's your host, Wendy P. You are listening to Vino Soul Talk. And thank you for listening. I just want to give a shout out to anybody who has turned us on and given us your attention, because I know you're busy. You've got a lot of other things on your mind. You've got a lot of other things and people vying for your attention, and you've taken time to listen to us. So thank you. I'm so grateful that you have tuned in. So on that note, if you have been listening, whether this is your first time or you've been listening since the beginning, let other people know about it. What you can do to help support us is spread the word. Write us a positive review on iTunes. Share our Facebook posts. Tell your friends about it. Anything you can do to help spread the word would be so fabulous and so appreciated, because I think that the messages that I've learned and that the guests on this podcast have shared with us, they're so valuable. And I think people out there can learn, just like I have, from the people that we've had on here, from these special spiritual and holistic practitioners that have tapped into that higher consciousness that we're all kind of trying to get into. They've got tricks and tips and wisdom to share with us, and they came in and shared that with me and with the world, and somebody out there could be waiting to hear that message. So please, if you'd like to support us any way that you can, just by spreading by word of mouth, that would be fabulous. Our main sponsor and supporter of Vino Soul Talk is vinosoul.com, and I want to talk about that a little bit, just in case you aren't familiar with what that is, and it could be of value to you. So Vino Soul is a platform that helps to be a hub for holistic and spiritual practitioners, alternative health professionals, that kind of vein of taking care of your health and emotional and spiritual and mental well-being. It's a place meant to connect people with that are interested in those services, that need those services, with the people that offer them. And right now, it's kind of filling a hole. There isn't a centralized hub for that, and Vino Soul can be that. So if you are a practitioner yourself and you're looking to find more clients, vinosoul.com, perfect way for you to do that. You can create your own page there, and that can be a hub that goes out to your social media pages, your appointment booker, your personal website, but it also gives you the option to use that as your website. And it's really affordable. I promise it's not going to break the bank as far as marketing tools go. It's really low key, or on the lower end of the spectrum, price wise anyway. And you can put any kind of specials you're running, if you have events you're going to be at, if you're offering classes, all of that kind of stuff can be uploaded there and people can find you. So when somebody goes to search for a certain modality or a certain service, let's say a Reiki practitioner, and they are looking for one in their area, Vino Soul will lead them to you if you're in their area. So it's also great if you're not a practitioner yourself, but you're curious about this stuff and you want to know, I don't know how to find these people that I need. I don't know, who's a psychic that lives near me, or who does the raindrop technique, or who is a massage therapist that also does energy work. Like, these are all things that you can find at vinosoul.com. So I encourage everybody to go check that out. And let us know what you think. We're open to feedback too. That also goes with finding access to myself. I'm definitely open to hearing what you want to hear on Soul Talk. I am readily available on Instagram. My name there is Wendy P is Magic. I recently changed it to that from a different thing. And that's been fun. I don't know. Magic just seemed to kind of go in line with all my rainbows and unicorns I was sharing and the magic that we all have inside of us, right? So find me on Instagram. Wendy P is magic. I'm also available at the email talk@vinosoul.com. Happy to take any questions you may have there, any show suggestions. You know, we're working on the programming constantly, so reach out to me there. If you're interested in being on the show, you're a practitioner yourself, or you have some knowledge that you think our listeners would be interested in, get in touch with me. We'll see what we can do. I am certainly open to people from all walks of modalities, all kinds of services, and I'm going to start trying to do long-distance podcasts over Skype or phone. I'm not sure how technically we're going to do that yet, but I want to reach more people than just those, in Iowa or can make the trip to come sit at my kitchen table. So, yeah, if you know somebody, but they don't happen to be somebody that you think we could connect with in person, that's okay. Still, reach out to me. We'll see what we can do if you're going to be a good fit and if I can make this technologically happen. All right, so now that we've got the business out of the way, this week's guest, she's been so helpful for myself personally. She knows her stuff. It's Linda Bradbury, and she is the owner of Inspired Guided Motion. She is a licensed massage therapist and also an expert in young living essential oils. And I will tell you, she knows her stuff. I personally, this isn't on the podcast. I mention it, but we talked about it off air. And but I wanted to share with you because it really helped me. I've been dealing with this ear infection for a while. I tend to be kind of prone to them ever since I was a little kid. So they're really bothersome to me. And I had already went to the doctor for it after I couldn't get it cleared up on my own. I took a round of steroids for it, and it just didn't clear up at all. And she suggested some things I could do with essential oils, and we're sitting here 4 days later, and my problem is gone. She is a genius, and she, explained some things that I hadn't really known about oils, even though I've dabbled a bit, and suggested some that I wouldn't have thought to use for an ear infection, and it cleared right up. So thank you, Linda, if you're listening. I thanked you in person too, but I wanted to throw that out into the world because she could help you. And, it's not just a sore back or aromatherapy for your house to make you smell nice. It's real stuff. So anyway, you don't want to hear me ramble anymore, do you? Let's get to the podcast and get to the good advice from the wise and powerful Linda Bradbury. Enjoy. Hello, world. This is your host, Wendy P., and I am sitting here with Linda Bradbury. Thank you so much for coming in today, Linda.
Thank you for having me.
Yeah, so Linda is the owner of Inspired Guided Motion. She's a licensed massage therapist, and she also does craniosacral therapy, and you are a sports practitioner. That's correct as well?
Correct.
So lots of letters behind your name. And I'm excited to hear all about that. So what I usually do is allow people to kind of talk how they got into their, spiritual or energy work as the Vino Soul family. So I'll let you kind of take it from here, and I believe you have a very interesting story to share with us.
Well, thank you, Wendy. I do feel like sometimes it's pretty kind of different, but so I've always wanted to be a nurse, and for whatever reason, that never happened. I believe everything comes in our path as we are supposed to see it. Didn't always agree with that in the earlier years of my life, but I never became a nurse. And so it was many years into life that my brother had had many accidents in life. He was in construction and different things, and even our horse throwing him and breaking arms, breaking bones, back, neck, shoulders, legs, whatever. He had all but 2 bones that were broken that Evel Knievel had.
Wow.
So he was in a lot of pain, and so that pain brought on a lot of medications, a lot of what we might even think of today as abuse with the medications. But things just kept escalating with him, and finally he agreed to do some myofascial release down in Sedona with therapy on the rocks. And it was totally out of the realm of what everybody was looking for and expecting, but he was getting nowhere quickly with they're wanting to do more surgeries, and we're just bringing more things into his life in the later future. So he went down there. It was a 3-week program, 3 times a day, 3 hours a day.
Mm-hmm.
And what myofascial release does is we have fascia in our body that's surrounded. It's a thin sheath of skin underneath our skin that surrounds everything in our body, the organs, the tissues, the nerves, and everything, the bundles. So when we've had accidents, when we've had surgeries or anything like that, emotions, that fascia gets tightened around things. So it starts having restrictions on blood flow or the nerve generations, or being able to feel and touch, and just all kinds of pain begins. So he did this treatment down there, and on day 8 he called me and said, "You're never going to believe what I'm doing." And I said, "I have no idea," because I'd been talking to him every night, and it was like, wow, I can't believe what's happening to you. It's such a turnaround, because they took all medications away and only good food for him and what have you, and he was running. And he had not ran for many, many years.
Yeah.
Many years. He was a track runner in school. And so I got really intrigued. I started really watching him. And his journey started making such a change in life. And watching all of that, I decided then that nursing was not what I was supposed to be doing in life anyway. It was supposed to be the other side of the spectrum. And so I just started watching. He introduced me to the Reiki, and he was doing weird things like trying to get my hair to stand up with, the energy techniques. We all thought he was kind of a little goofy, but he went one day then after the treatment, and he had become med-free, started being able to control his own pain, and he did a vision quest in the desert, 4 days and 4 nights with no food and water.
Oh, wow.
And so even him telling me about that journey started me into my more spiritual journey, because we had never had a lot of that in our life. And so this is all new to us and me, and him doing that. He'd always been in the nature, hunting and different things. But at that point, he gave up his gun, and he went hunting with people, but he took his camera now. And so when I started seeing things like that changing in his life, and he started bringing more information to me spiritually,
mm-hmm.
then I really started becoming interested in that we can actually have a big part in how our body heals, how our body is responding to different things, what our emotions do to us, what happens when we've had an accident or a surgery or whatever. I started watching really closely with myofascial release.
Mm-hmm.
And so that is how I began my journey then to craniosacral. And I'll just be really upfront and honest. My brother passed away in 2007. Was after all of his treatments. He had a heart problem. And so I could not do the myofascial release. But it actually came from craniosacral in the beginning. Yeah. Myofascia is a takeoff kind of the craniosacral. So that's when I began the craniosacral work, and I've been going at it ever since, mm-hmm. bringing the energy techniques, which is looking within, finding our own higher power to help us to understand how we can check in with ourselves. We all have an inner physician within us, mm-hmm. and that inner physician, we can talk back and forth to each other spiritually. And so when we're working with craniosacral, we're actually... I ask the 2 inner physicians to come together to guide the hands. And then that helps us to take... There is a technique with craniosacral. However, then you start learning to listen to what it is that you need to do with your hands and the people. Mm-hmm. And so 5 grams of pressure is all you need when you're treating someone with craniosacral. And so it's the algorithm of our body because, we're 70-some% fluid or water. And so think of the ocean, how the ocean just flows, and when there's turbulence, how it has the big waves. And so our body is the same way. Whenever we are doing our check-ins for to start a treatment, to see where maybe we don't have that exact algorithm that we should in our body. As the practitioner, we can actually kind of feel, is it in the hip area, is it in the neck area, or whatever. Mm-hmm. And so that's what we do. We check in, just find the algorithm of the body. And then we begin our treatment based on that. So that's a little bit about it. Mm-hmm. So do you have any questions for me to see where we might want to go with this?
I'd love to get maybe a little more in depth of what craniosacral is. Maybe you could walk us. I know it's hard. I know it's hard to exactly walk us through a treatment, but maybe what you could expect if someone's going to have this service from you.
Great question. So when someone comes in, you're fully clothed for a treatment. So you lay on your back. You can have blankets or whatever, because sometimes it gets a little chilly. But so we will start at the feet and start with a check-in there, and just we feel the algorithm of the body. Sometimes the feet might kind of feel like they're swaying in and out. I don't know how to say describe what I'm doing here, but or maybe our body has a little rocking motion to it. So we check the thighs, we check the hips. The diaphragm area, and then the neck area, and also our cranium. So craniosacral is actually working with the cranium, the skull, and down to the sacrum, which is the bottom of our spine. So that's what we're mostly working with, but we find the rhythm through our whole body, because anything below the waist is what we're going to find that we need to work on, probably from checking in at the feet. So we'll start at the waist or the hips then. So we start in the very beginning in the neck area. We just hold our hands underneath, always lying on your back. And we're just cradling your head into our hands and with our fingers at the very base of your neck. And we're just kind of opening up. We're letting that spinal fluid move into the cranium or up into the brain area to make sure that fluid, sometimes with all the restrictions around in our neck, we wear our shoulders and our ears sometimes. Well, it's also very relieving to open that neck up to where it can breathe again, if you will, and to let that flow go. So it's getting that flow in the spine, the spinal fluid and the cerebral fluid to working in a better way.
Okay.
So first we begin with kind of working the neck area, so it's really relaxing. I start all of my massages with that. I'm one of the only or very few people that start people in a massage on their back, face up. But I think that we can really relax a person. So another thing, too, with craniosacral is working a lot with the ears. So we have those eustachian tubes and all the sinus cavities drain into the ears. We have a lot of ear problems in children. We have a lot of ear problems with adults. A lot of times that is the congestion getting stuck there. And so there's a technique that we work just with the ears to help open that up so that we can start getting the drainage going again. It's very really soothing to have your ears worked. I don't know why, but it is.
Yeah, I'm going to have to come see you. I've been fighting this weird ear thing for a month.
Well,
and drugs aren't working, so.
No, sometimes they don't. But if you think about how craniosacral is working more than just with that. But, when we're working with anything, whether it's massage therapy or the myofascia, or we're loosening up that fascia, those neck muscles, because we think about a lot of times just those big muscles on our back, on the outer part. But when you look really in depth into the body, we have hundreds of tiny little muscles, ligaments, and tendons. And that fascia wraps around everything. So we have to get all of that opened back up. And, our head is pretty heavy sitting on just this little axis up there. So opening up all of that, because we're getting a lot of strain, even in the front, the throat muscles, just opening some of those up is what happens with craniosacral too. So we're getting a lot of, it feels like maybe stretching. Maybe at the end it feels like it's been stretched, but it really hasn't been a lot of of movement, on our part. The ears probably to me is one of the biggest parts, is what you're saying there. But it's also to help get those sinus cavities going too. And I believe that we can gain focus, cognitive things going on with us. So we're opening up that blood-brain barrier back there, I feel like, to let things go through a little better. And then we work with the temples a lot. So also in the skull, we have all those little sutures. So think of those little sutures as gears. And if those little sutures are not flowing just perfectly within each other, so say we've had a hit to the head, and maybe those sutures got just a little bit thrown off, well, that can actually press onto the brain. So, maybe the headaches or just different things happening. But with craniosacral, we can actually help to bring that back into place. We can help loosen that fascia up around there. We can help those little gears get back into place, if you will. But just working with all of that, it's that. And then we can work with the frontal lobe by just doing a little bit. It's just that 5 grams of pressure. And people think, oh my gosh, this is not doing anything. But you can actually get off the table from having a craniosacral treatment and feel like you've had a full body massage without the tissue movement.
Wow.
You can be that relaxed without it too. So, but then after we worked with the cranium and everything, we can work down the spine. So there's techniques that we can hold our hand under on different parts of the body and another hand on the top of the body and try and to just melt into the body. So like melt into the tummy or whatever, and it helps to relieve some of that fascial restriction in there. Maybe we're having some cycles going differently than we usually do for women, and we can help to relieve that discomfort that's going on with that too. Hip discomfort is huge. We can just kind of melt into that. So we have a lot of times people are breathing real shallow. So if we don't really tummy breathe, with the diaphragm breathing where our tummy goes out when we breathe, everybody wants to hold their tummy in,
Yeah.
But if we don't let it really extend, then we're just kind of just shallow breathing. So opening that up and taking some of those deep breaths, even as a massage practitioner, I have difficulty making sure that I get that stuff done too. And I'll tell you what, when you do, you breathe a whole lot differently. So we can even open up the pecs, the chest cavity up here a little bit and help that to get breathing going too. But even that, when we have respiratory stuff going on, I've had some people in with COPD and different things, and they come in barely talking because they're so shallow breathing. But to help open that up, they can carry on a longer conversation sentence as they go on. Not that that's going to happen with everybody, but it is something that we can work toward.
Yeah, I'm really fascinated by the connection. Well, the connection for everything. But when you were talking about using this as a way to improve cognitive function or as like a supplement to medical treatment or whatever, obviously you can't claim to cure anything. But when we work with those together, I think that's such an important thing to point out, is that most practitioners in your line of work or whatever are not saying that you should forego medical treatment completely, but there's a reason that you should address everything holistically, and that like things like craniosacral can address some stuff that your doctor can't, or put your mind in a place that's better to help you heal, because the mind is so powerful.
Right.
And I'm just really fascinated by like our connection between mind and body, because we have a tendency to separate them, but it's not separate.
It is absolutely not separate. And one of the things that is very important that people may not realize is human touch. And so when you we have a lot of separated families, we have a lot of disconnect and what have you. And I know from me, it was great to have a massage every month before I ever even got started into the practice of doing it myself. And I see clients that I have that, it's just single moms or whatever, that's really the only human touch that they get. We're so busy in our life. And even if you realize how often you might even be drawn to just tap somebody's back or rub their back or, grab a child's hand or whatever, there's something drawing us to do that maybe there's a connection that needs to be taking place. I feel myself do it a lot, that, I might just rub somebody's back while I'm talking to them because you can almost feel that they need that human touch. And it's very important to get that. And we don't really have it a lot like we used to have it. Yeah. And there's a lot of people that's grown up that never had it at all. And that's hard for them to accept too. But then you can tell the light bulb kind of goes off even if you just touch their back. And so massage, craniosacral, some people don't want to get undressed for a treatment. And this is a perfect type of thing for those kind of people that are not there yet. Yeah. And but yet they can have some soothing energies going through.
Yeah, that's a great point about getting just human touch and human interaction. I think so many people are starved for that and don't realize that that's what they're missing, and we all, love massages, right? Feels great. But that's a good point that you're making, that it's also like a, human connection. When I was doing Reiki a little more regularly and people would ask me like, what's the benefit of having a session? I would always say, well, explain what Reiki is and energy work and stuff, but that's sort of hard for a lot of people to grasp. And I said, I would also tell people that it's an hour where one person is focused on you and caring about you. And how often do we get that, And that's a cool thing about this podcast too I'm enjoying, is like, how often do I sit down with somebody and just talk to them for an hour? Right. And that's, we should do this more. But podcasting is a way for me to do that. Sorry about my dog. Just to push her off. She wants to be involved too. But yeah, that's a really good point that you're making, that that's an element that people kind of don't think about when they think about energy workers or massage therapists, is we all need that.
Well, and personally, I think it's just as good for me, because even though I'm not receiving the touch, I am giving the touch. Yeah. And so maybe that's one reason, too, that I'm a little more grounded in something like this, too, because I see a lot of my friends that's really kind of starving for it sometimes, or just people that I'm around a lot. But I get to interact a lot. I get those treatments, but I also give them a lot. Yeah. And so maybe that's why, I never really thought that much about me, but it brings a lot of benefit to the therapist, too.
Yeah, I would imagine it does. I know that when I've done Reiki sessions in the past, that I feel almost like I've received one too, because you have the energy flowing through you and you get to like interact with that person's energy, and it's meditative. It's a meditation, really. So you feel better afterwards. So I could see, I've never really given a massage, but I could see where it would be a similar experience. So that's interesting. I feel like that's something I should explore more in my own thoughts about how we could bring more of that into the world.
Well, and I, too, am a Reiki master, master teacher. And so the room is always Reiki'd every day when I go in there. So if somebody wants a special treatment, that's great, too. But I just feel like I'm always kind of connected. So whatever techniques I use, it's always a therapeutic treatment. It's kind of hard just to say I'm giving you a massage and that's it, because you've always got that energy flowing through you, and everybody has their own way, their own technique, and that's what's so great about it, is we have so many massage practitioners in the area that we all have such great gifts to give. And so what might work for one may not be for the other, and that's okay. Yeah. We just have a great connection here in the Des Moines area, I think.
Yeah, that's good. We have a lot of opportunity and community, I think, and that I don't know what it's like other places, but I don't think that's the norm.
No, I'm from Kansas City, and it's a little different in both places, but I feel really connected here. Especially, it was an easier flow for me here. Maybe it was someplace I was supposed to be. So
could be. Yeah. Like you said before, there's not really any accidents. No. Everything sort of has its own way of showing its importance in time, right? So, and you do so many different things. I would love to talk more about that too. in addition to your energy work, you are also very into essential oils. Correct?
I love my essential oils. So I began that journey back in 2009 because of my brother also. Mm-hmm. And can I just share how my name came about with my
absolutely.
business? So the name of my business is Inspired Guided Motion. And I found this when I was in massage school, and it just stuck with me. And it came because of a couple of different techniques that my brother had given me or taken me to. But I feel like I am inspired by God, my higher power, mm-hmm. whatever everybody else's might be. I'm inspired, and then I am inspired by everybody on my journey. I'm guided by God, and it's my place to put it into motion. Mm-hmm. So I think that I give a real spiritual practice is what I have. But in my essential oils, then, I do love my essential oils, and I love what they do for me. I try very hard to never have to take a medication. So with the techniques that I have, with the friends that I have that do different techniques, mm-hmm. we are able to help and support each other through a lot of this stuff too. So I do classes on them. We talk a lot about how we bring toxins into our life in different ways, whether it's environmentally or through the food we eat or the lotions we put on us. Our skin is our first defense, mm-hmm. and so whatever we put into our skin goes into
bugging you?
Our bodies. And so I love teaching on that too, as mm-hmm. to how we can help bring it into like massage practitioner or massage therapy, that we can do a lot of benefits for ourselves through holistic ways, which is really the first ways on earth was through the essential oils, you know, and then just the different ways that if we start listening to who we are inside and what we are, and we listen to our bodies, like sometimes people come in, one of the first questions when they say my low back is hurting, the first question is, have you had digestive trouble?
Really?
Because if your digestive system is kind of inflamed, you're probably pushing, if we get cramps, mm-hmm. we get low back pain. So digestive, low back, or there's just different things that you can ask to start looking to see what can we figure out ourselves before we start pumping a medication in there to immediately mask the pain or mask the discomfort or whatever. Mm-hmm. And maybe we got too much acid in our body. Let's level that pH out a little bit. There's just a lot of different things, and I'm by no means a doctor or diagnose or treat, but sometimes we can actually kind of start looking at what we've been eating and how it might be causing it, or just even different questions I can ask for them to start even looking at what they're eating or journal what it is. And it's not always about the essential oils. Maybe it's just let's have some vinegar, or whatever, but just doing our research for us to start learning how to research, to find answers for ourselves, to even ask our physicians mm-hmm. about what we could do or should do about something.
Mm-hmm. What would you suggest to somebody that is interested in kind of taking control of their own health, but isn't sure really how to check in with their body? Sometimes we can be like you said, low back pain. You're like, well, my back hurts. But what would be your suggestion for a good place to start? So, if somebody were to come into my office brand new and saying I'm having a lot of low back pain, mm-hmm.
I might ask about their fitness regimen. Do they walk? Have they changed anything? Have they started anything? So let's look and see first if it's physical. And then, maybe even talking about, have you had surgeries or anything lately? Or change of medications, because sometimes that can happen. And maybe even just, have you started eating any different foods? Have you changed your diet in any way? Mm-hmm. Could just be that digestive thing. So just kind of starting to narrow it down and find out who they are, because we all come from a different place.
Yeah.
And it's taken years for me to start really looking at me. I know immediately when I've been eating way too much red meat.
Yeah.
I have digestive problems, but that's something that I have learned to look at.
Yeah.
I've done a few cleanses. We have through Young Living an ambassador that is a pharmacist with an F. She's done a lot of research and everything, and she's taken us through a couple of cleanses where we take meat, dairy, sugar, caffeine, and alcohol out of our diets for 21 days. and seeing the results from that, just even journaling every day how you feel differently, in that we might, a lot of times it's our inflammation in our body that's our problem, not so much what we're eating and everything, or it's how it's affecting us, but it's the inflammation. So losing inflammation can be a huge benefit in so many ways. It doesn't mean that you're losing pounds, but you're losing some inches. And so that's pretty great too. And then that goes right back to the therapies too. So we can help move that tissue around a little differently and easily too. Lymphatic is something that I'm really interested in, and we'll probably pick up in 2019. Is doing lymphatic drainage.
Drainage, okay. Yeah, I'm really fascinated with that too. Recently, the more that I learn about it, I don't know that much about it, but I didn't even know what a lymph system was until maybe like a year ago.
Right.
Just in like trying to figure out my own things. But yeah, the fact that it doesn't circulate like blood, and so you kind of have to help it along,
right?
With exercise or massage.
Encourage the drain.
Yes. Yes. And inflammation too, that so often when you start digging into something, you find out, inflammation could be the cause of this, and it's the cause of so many things.
So many things.
Yeah.
And, and I don't say that nobody should ever take medications, but sometimes those medications are masking the reasons what we need to do.
Yeah.
And so, if we can, I've been on medications before in my life that's been a lifesaver, but that got me through the point to where I could start looking at what I needed to change then. So don't ever go off your medications, and don't not go to your doctor. But then start looking too, and ask them about it. I think just as much that the doctors, I know one of them, sometimes they're not quite sure either, because that's out of their realm. They've, that's different for them they've been taught one way, and that's a great way, and we need a lot of that. But to bring all of it together is phenomenal, I think.
Yeah, we have a tendency, and I don't know if this is, a medical tendency necessarily, but to just focus on the thing that's aggravating you, the symptom or whatever, rather than like looking at the whole picture. And our bodies, everything's interconnected, so we really have to think about the whole picture.
Right.
And just like you said, medications can stop the symptom, but not get to the root cause of something. A good example in my life is like I really don't take cold medicine anymore. I always thought that it was helping you get like along the way, like helping you actually get better. But it really is just stopping your body's fighting whatever it is. So if you can just suffer through your symptoms for a couple of days, usually my cold will go away on its own. But if I do take cold medication for some reason, it tends to extend the cold, because you're stopping your body's own defense of fighting whatever it is.
Right. And there are times that we got to do that because we've gotten to a point.
to do stuff, yeah.
Because we might have let it go too long or something. But, sometimes we're wanting instant gratification because we're busy. We have things to do. We've got jobs. Who's taken off and who's not taken off in the family to watch this or to do that.
Yeah.
And so it is difficult. So we reach to medication to help. And we want that instant gratification, whereas sometimes our body should fight it because it's liable to come back much faster. We might have a few weeks or a month or two's relief, but it's not gone. So I look at, our digestive system too, when we've taken too many of those antibiotics and we've killed the good and the bad flora in our body, or, then we have to rebuild, and those where probiotics come in, and it's just a vicious circle that we have to start learning and understanding. We have seasons to do cleanses, to dump the colon first, because we got to be able to get the toxins out.
Yeah.
So, I could go on, in different ways too, but you really just have to start paying attention and listening. We have a lot of autoimmune disruptions now in the world, and what's causing those, and how are we getting to that place that, with all of that?
Yeah, that is a interesting sort of trend, I guess. And I don't know if it's now just being diagnosed as autoimmune disorders and it's always been a thing, or if there really is more of it. I don't know the answer to that, but I just was recently watching something on Netflix. They have a series called Afflicted that is people basically that are sick and can't figure out what's wrong with them. And a lot of them end up getting the diagnosis of like Lyme disease or an autoimmune disorder. And they typically have to end up going to like a holistic practitioner to find that out because the doctors don't know to test for it or don't understand their symptoms the way that they're presenting them or whatever. So it's kind of a fascinating show. And a lot of it, too, they're getting told that it's in their head, you know? And I think probably in some ways it is in your head for some of the people because it can manifest when you have emotional problems or things that you're not dealing with can manifest itself physically.
Absolutely.
So when someone says it's all in your head, it's not necessarily saying it's not real. It's just that you could also, there's a psychological element to it. Mm-hmm. And that's really interesting to me to like watch these people go through that.
So there's a couple of books out there too, Feelings Buried Alive Never Die, and then a Louise Hay's book. I can't remember the name of it right off the top of my head, but they're books that you can look at like a symptom or a triggering factor, and it helps you with what emotions might be tied to that or what part of your body could be tied to it. I have another client that does dental decoding.
Really?
So, you know, we can find out a lot of things, like all of our teeth are tied to an organ. And I didn't do much research on this till I had some jaw surgery because I had a tooth that had a cyst growing around it, a wisdom tooth, and they had to do surgery. And so today I have a really difficult time knowing that I'm hungry because of what that tooth was tied to in my body. Oh. And then also the pain that goes down into my elbow from probably the way they had me opened up doing the surgery. I still have a lot of neck trouble. Mm-hmm. So I bring this up so people can start thinking about it's not just because I tripped and fell, you know, or they didn't cut that part when they did my surgery, but when they do a surgery, they can literally do all kinds of things with your body. Mm-hmm. You know, and so you don't know what all is being affected when they do this surgery. Yeah, you know, have they flipped you and turned you? Mm-hmm. And I think of a little person that had to have 3 different surgeries when she was in an auto accident and broke her pelvic in 9 places. She has 3 different surgeries. How did they twist and turn her? And what did they do with, you know, everything as they were putting those pins and what have you in? Yeah. So just because we had a surgery and just because they cut in one area doesn't mean it can't affect many different parts of our body.
Yeah, that's a great point. And also it's a trauma too.
Very much.
That like you have to kind of deal with emotionally. Like you got cut open. That's traumatic.
Right.
And yeah, whatever they were doing, you know, to you while you were unconscious, mm-hmm. you know, and we haven't really figured out how much our unconscious is aware of either. Right. So you know, could have been experiencing all that while you were knocked out in a weird emotional way. So it's definitely a traumatic thing to have any kind of surgery. So, but it's great that you have people like you that understand that and can, you know, help people ask those questions. So would you recommend like, for someone that wants to listen to their body more, like journaling every day is a good way to do that, or just like documenting it? I found that with like food and things like that, it's helpful if you just actually know what you're putting in your mouth, for example. Right. Because we do so much stuff without thinking about it.
Food journaling is probably the best mm-hmm. we could do, but also then to include in that journal, was there an emotion tied to it? Mm-hmm. Or I took something out and was there, like, I love crunchies. Yeah. I love crunchy foods. And so, you know, what do we typically go to for a crunchy food with chips? Yeah. And so trying to just go to celery for that. But what is the emotion that might be tied behind that chip that I love? Mm-hmm. Did I not get it when I was a child? And that's not true because we did have them. But, you know, there's something about an emotion tied to that chip or something that I still have not figured out. I have figured out a better way to eat my chips or what kind to get. But, you know, we have an emotion tied to almost everything, mm-hmm. and it's really hard to do it. So when you're journaling your food, not only are you journaling about what we're eating. But that's kind of an intense thing too. But just starting out by just journaling your food. Mm-hmm. And then I'm a coach also, so I will sit down sometimes and just talk to them about what was the emotion wrapped around it, or what do you feel? How do you feel about what you've eaten? Mm-hmm. And it's just asking questions. I don't really give any advice because I don't know what to give, but I remember years ago people were asking me a lot of questions when I was going through something pretty traumatic in my life, mm-hmm. and it was just really me answering my own questions. Yeah, they knew what questions to ask to get me to start thinking about it, and it may have happened 3 weeks later when I got my own answer. And sometimes you're like, why did you even ask me that? But there's a reason for all of it. Mm-hmm. And to be able to get ourselves to start by usually journaling our food, mm-hmm. and then maybe we bring the emotion if there was something, or did we start walking? How did that feel? And, what, just you start with baby steps. That's mm-hmm. all we can do. Because if we jump in full force, we're probably going to fail. Yeah. Probably.
That's so true with so many things.
Right. Just like our New Year's resolution. By March, we're all done.
Yes. Maybe March. Maybe we make it to February. In my experience. Yeah. That's a good point. I like the baby step idea. And just, a lot of times it just comes down to checking in with yourself, taking that 5 minutes to go, how am I feeling?
Take that deep breath.
Yeah. Take a deep breath. I don't think that a lot of us do that enough.
We'll even have those apps, like the apps to have water, or just the apps to stand up every 50 minutes at your desk and take 5 minutes to yourself. To meditate, we don't have to sit down and do the thing. Mm-hmm. We don't have to. I actually meditate a lot during my whole day. Yeah. When I find myself just not in a focus of thought of something, to me, that's a meditation, and I'm bringing in different energy or different thoughts, and sometimes it's like, where did that come from? So if you have those aha moments, you've probably been some type of a meditation. You've been asking that your inner wisdom, your inner guidance, mm-hmm. and just say thank you, because it was something that was brought to you for a reason. And if it's something that keeps just popping up, like... I can't even think of it now, but just popping up the same thing, like even just saying massage, that mm-hmm. keeps coming in your head, probably a reason why you're needing them for some reason, or any other kind of technique or whatever too. Anything in your life. Yeah. You're probably in need of that for some reason.
Yeah, I love the idea of making other things meditation, because I don't know why it's so hard to sit down and be still, but I find it very challenging, even though I do force myself to do that. But yeah, just in the morning, only think about making the coffee. That's a lot easier for me to swallow for some reason, doing something and just not thinking about other stuff while you do it. And I think a lot of people have misconceptions about what meditation actually is. So I love that you brought that point up, because it really just means being present. Right. Ultimately. And you can do that if you don't want to sit on a mat and close your eyes. You can do it all day. Mm-hmm. Just check in with yourself, or your higher self, or whatever you like to call that. That's a really good point. So, so how can people get in touch with you if, this is speaking to them and they want to learn more from you or get services from you? Tell them where they can find you, where they can contact you.
So my website is Inspired Guided Motion, or ylinspired.com. They can go there. They can go right from there to a scheduling tool that will tell all the services that I have. Okay. Or they can also, if they're interested in Young Living, they can go to the Young Living site, and we can set up a class for them. We can set up a call. I do online classes also. Okay. So if you're not in the area, we can still do it online. I can mm-hmm. send you some samples if we'd like to do that. But I'm located in Ankeny, Iowa, and I have my own office, so it's a private office, and they can get a hold of me there. Come see me.
Yeah. I think the thing you said about the ear thing, I might have to come get that done, because that's my own personal thing, but we'll talk off the air about that. But I've actually had that experience before in just getting traditional massages and it helping me with my sinuses opening up. So it makes sense that if you're really focused on that it would help with that, getting, and that's not something that a lot of people, at least to myself, think about, even though I've had that experience, that you can get relief in areas that aren't like your back or whatever,
Right. So something that just came to me because we have a friend in here today is we can also do it to the animals.
Oh, yeah.
Yeah.
Oh.
So they love their massages. We all know that. But
yes.
you can also do these other techniques with them, too.
Mm-hmm. Yeah. I have do Reiki on them and have found that they really enjoy it. My dog more than my cats.
Yeah.
But
yeah.
I had a cat that she passed away recently, but she was into it. But she would let you know pretty soon when she was done. She was like, oh, yeah, I'm into this. Okay. Yeah. Oh, no, I'm done. Just like so many other things with cats.
Cats are pretty high energy themselves, so
yes.
they're actually healers for us.
Mm-hmm.
And so they probably take less than what we would probably give to our dog or whatever, too. But, yeah.
Mm-hmm. And another, we had I guess it's been a couple years now, but a dog passed away, but he was having a lot of like hip problems and stuff, and he loved the Reiki. Like he wouldn't be able to walk, and I'd give a little Reiki and he could get up and walk for a little bit, and it was so crazy to see that helping him. So yeah, if anybody is ever, and you teach Reiki, correct? So yeah, look into that and get in touch with Linda or someone else that can teach you how to do this, because learning how to work with energy is so helpful in so many areas of our lives. I use it on my plants too, and our animals love it, and it feels better if you know how to use those techniques in your home and all that kind of stuff.
And you trust and believe.
Yes. Yeah.
I think that's the key to almost anything we do in life anymore,
mm-hmm.
that we trust and believe.
Mm-hmm. And just having like, what's the word I'm looking for? Yeah, I guess faith is the word. Mm-hmm. and intention. Mm-hmm. That's the word I was looking for. Having the right intention is always the most powerful thing.
Sometimes we think some of the most off-the-wall things that people won't accept or they'll make fun of us for, or so we tend to hold them in and keep them quiet. And it's not like that so much. I mean, there is still that, and I think we'll always have that. But I think that when we start growing within ourselves, then we will function much better and move forward in life and be a better person in whatever that is you're looking for.
Right. And I think I definitely feel a shift on a broad scale of more people being open to this kind of discussions that we're having right now. But it starts with yourself. Like the more that you open yourself up to it, the more people that open themselves up to it, just individually focusing on themselves, it creates a collective...
An attraction.
Yes.
Yeah, and I don't mean a better person like that you're a mean person.
Right.
I just mean a better person in that you are able to help yourself along your own journey in whatever that may be that you're looking for.
Mm-hmm. More happy.
Right.
More at peace.
Right.
It's definitely a sense of empowerment if you find tools that work for you to take control of your health, take control of your emotions, rid yourself of anxiety or whatever is ailing you. If you feel helpless, these kinds of things can help you feel like you have some sort of control or let go of the control. That's my big thing that I'm working on right now.
I think you've got a key point there, because a lot of times we have to learn to love ourselves because we don't even know who we are. We're so crazy out here in this world trying to make sure that we're making everybody else happy, our kids, our husbands, our family, or whatever, or trying to fit in everywhere, that we lose track of who we are. And when we make a decision, we feel that little bit of uncomfortableness inside of us. And that's our inner wisdom or our inner guidance saying, I'm not sure this is right, and to start looking at who we are and feeling love for ourselves. Can you stand in the mirror and really look at yourself and say, I love you, and talk to yourself? I know people think that's crazy, but to know who you are. Because once you do that, then you're going to start attracting and feeling better within yourself.
Yeah, love for yourself is so very important. And I'm hoping that, this is reaching people that are listening to it. and giving them that message if they need to hear it. I'm having so much fun doing all of this, talking to people and having these conversations and introducing them to ways that they can learn to do that through healers like yourself.
Thank you.
And
we're glad you're doing it.
Yeah, it's been super fun. I hope that it's making an impact. I've had good feedback so far.
Great.
And, as far as I can tell, there's not a lot of these kind of discussions happening in this kind of format. So I think we're living in an interesting time that we now have this access. We can be sitting here in my kitchen, petting my dog, and we can send this out into the world, and that's so cool to be able to send those messages out in a different way. Mm-hmm. So I'm really grateful that, people have been, like yourself, are willing to come and talk to me, and that I have the access to this technology, and it's just great.
And we're grateful for you.
No, thank you very much. So one more time, tell people where they can find you.
I'm located in Ankeny, Iowa, and the website is Inspired Guided Motion, or ylinspired.com.
Mm-hmm. Okay, and you can go there and find Linda and schedule whatever you need from her, whether you need some coaching, whether you need some massage therapy, craniosacral, which I'm still fascinated about. I think that sounds like something we all could use, getting those brain waves opened up. And Young Living, essential oils. I think everybody could benefit from those too.
Absolutely.
I mean, I'm technically a distributor, but I don't really sell. But I have them everywhere.
Using them is the most important thing.
Yes.
Just so we have them to use.
Yeah, I found myself being really sensitive to like perfumes and stuff like that more and more, and even scented candles and stuff like that. But I have my Young Living diffuser going all the time, and I love it's like comforting, even though they have health benefits too, but there's just like something comforting about your house smelling good.
Right.
And you smelling good, and sprayed on my sheets and everywhere. So I really enjoy that personally. So look into that, everyone. If you are interested in learning more about that, go check out Linda.
Thank you very much.
Yes. Is there anything else coming up that you want to share with our listeners?
I don't think so.
Okay.
Thank you.
Yeah. All right. Thank you so much, Linda, for coming.